and let us take you back then to our conversation. We're looking at parliamentarians debating yesterday the impact that a shortage of frontline workers is having on the healthcare system, and in part they were also talking about the professionalization of the public service. But the critical issue here is the unemployment crisis of doctors, and you look at what an indictment this is, especially when you think about the number of some of these students would spend, for example, in order to be able to qualify. We are still in conversation with Dr. Akhtar Hussain, Employed Doctors Advocacy Forum Chair for South African Medical Association, on this issue. Doctor, let me firstly thank you for indulging us and just giving us a second there to be able to take that address. But as we were saying, despite numerous protests, interviews, conversations, everything that has been done and said about the shortage, this issue again in 2025 is still a subject of much debate. What does it tell us?
Thank you very much for having me in SABC. That's a very important question. This issue we have been discussing with National Department of Health, Provincial Department of Health, last more than 15 years, and we have been alerted them and we have been giving them warning sign. There's a crisis, serious crisis in the health system, but the leadership in the health department, they have got no vision. They haven't implemented any policy. The leadership is not even talking about the patient's care, patient's quality care, and day by day is just sinking. If you go to the public hospital, it will be an infrastructure problem, supply chain problem, shortage of drugs, shortage of equipment. So we have been writing memorandum after memorandum, but the national department, even the health leadership, never put any concentration to how to improve health of this citizen of South Africans. In fact, the answer coming, there no money, we don't have a fund, we don't have a budget. That is the answer coming from Department of Health.
Does what the minister says, right, that around 2,197 new qualified medical doctors, medical graduates have been placed for internship, does this go some distance towards, at least addressing this particular problem?
Yes, that 2,200 or 400, what minister is talking, that was the mandatory training for internship and community service. This is nothing to do for the employment of the doctor. This is the final, when you finish 6-year medical study, you have to go for internship training. So they are giving a false information in the public that we have employed 2,400 doctors. That is not true. This is the requirement by Health Professional Council. This is the mandatory training. Without those 2-year training under supervision, you cannot get a license to practice as an independent medical practice. What we are talking, after completing your internship and community service, at the moment, just now, this year, 2,000 doctors are unemployed. And you can see promise after promise, they advertise few posts, they advertise the sessional post. While they're advertising a few posts, they are taking away overtime of the doctors. If there's no overtime for the doctor, which I mean, if there's no doctor after 4 o'clock in the hospital, who is going to handle the emergency? Who is going to treat the sick patient? There will be empty hospital at night because you're going to take our money and only pay 8 to 4 job. So there are no doctor.
So I want to stay with this issue of training that you talk about. Doctors, for example, would spend years, in some cases, over 10 years, studying, training, getting themselves ready to serve, only to be told there's no space for them, or that they may need to go to other countries or explore the private sector, or even choose alternative careers. How disheartening is this?
Because they have reduced the post, they cut the post, they mismanage the fund, they utilize those funds to the another part of the supply chain or tender area or stealing. There's enough evidence that 13.5 billion was missing. Then we got a Tambisa hospital tender issues. And minister himself said, if there's no job, you can go and do private work or go other country and earn the money. because our doctors need to pay the bursary or the loan we have taken. They have to look after the family.
Yeah.
They say private practice is not that rosy because it's oversaturated.
Yeah. So just before I let you go, quick one. The country is rating itself for the rollout of the NHI. How much of an impact could this shortage, this continuous shortage, then have on the rollout?
Exactly. If there are no doctor you employ, how are you going to roll out NHI? Who is going to see all those problematic patients, sick patients? Okay, primary health care can be seen by nurses. Well, that is only BP and blood sugar and minor elements. What happened the surgery? What happened the transplant? What happened the cancer patient, renal patient? Its a list is very long. As it is, there is a very long waiting list. So NHI is still, we don't know whether it's going to be workable because the infrastructure is not there. Already hospitals are not working, clinics are not working. How are you going to provide the NHI services?
Dr. Hussain, thank you so much. Appreciate that. And let's see then, post this debate, what happens. And it'll be interesting to also speak to some of those in Parliament about what they do now, because they talk about that they need to find the money. And the budget is coming up soon. And one hopes then that maybe we can see the movement of a needle in this one. Appreciate your time. That's Dr. Akhtar Hussain, Employed Doctors Advocacy Forum Chair for South African Medical Association.